Hello, and welcome to this webinar on first steps to developing a research career. My name is Jerosch-Herold. I'm an occupational therapist and professor of rehabilitation research at the University of East Anglia. So in this webinar, I want to talk to you about the many ways in which you can get involved in research and make it part of your practice in such a way that it can transform clinical care. I just want to say I don't receive any financial or other benefit from the RCOT for this webinar, but I have been a recipient of National Institute for Health Research fellowships and NIHR research grants. However, the views that I express here are mine and not those of the Department of Health or the NIHR. I think it might be helpful if you hear a little bit more about my own background so that you understand where I'm coming from this. So I qualified with a diploma in occupational therapy and began work at Addenbrooke's Hospital on a physical rotation. I also had a short stint working in Virginia in the USA, and I eventually specialized as a hand therapist. During that time, I began to ask clinical questions that I really felt I couldn't answer just by practicing, and I increasingly found myself disappearing off to a very good medical library at Cambridge, and this really started me thinking about perhaps I needed to do some further study and learn a little bit more about research. And in order to do so, I embarked on an Open University Introduction to Psychology program. And that was a very good way of introducing me to some quantitative research methods. That then got me thinking about doing a master's in rehabilitation studies at Southampton. It was one of very few programs that were around at that time. And it was my first exposure to doing a primary piece of research in which I looked at standardizing the assessments that are used for people with peripheral nerve injuries of the hand. However, it's fair to say that at the end of doing my master's, which I very much enjoyed, I was very much left at a crossroads because the choice was really between going back into clinical practice where I probably would not have the time and the support to do research, or to go into teaching or education, which at that point had just become degree level. And I chose the path of going to work at University of East Anglia as a lecturer because I expected there to be opportunities and indeed expectations for me to continue to do research. So not long after I started as a lecturer, I also decided to study further and undertake a PhD, which I completed. I subsequently was promoted to a reader or associate professor. And I then held a couple of National Institute of Health Research advanced fellowships. And these really launched my research career in a way that enabled me to finally secure a chair in 2017. Now, when I recount my career trajectory, it might all sound like a very linear, coherent path, but of course it was anything but that. And indeed, we all face hurdles and barriers and doors shut on us, but also other doors open. It is also fair to say that I have often been lent a very helping hand by important colleagues and mentors, and without whose help I certainly wouldn't be here. So I'd like you to really consider to make research part of your career path. But let's start by thinking about who research is important to. It is certainly very important to patients. Not only do they value being able to participate in research and knowing that they are being treated with treatments that have evidence for their effectiveness, but we also know that patients that participate in studies and in research active trusts that the patient outcomes are actually better. For the organization itself, There are clear benefits because those organizations which offer research careers and research support find that staff morale is better, they have higher staff retention, but also find it easier to recruit staff. And the Care Quality Commission now includes research as one of the important quality criteria. And then finally, it should be important to you, not least because it will make you a better clinician, but because it brings rewards and career progression. And for those who are working towards an advanced clinical practice framework from the Health Education England, you will know that research is one of the 4 pillars or one of the 4 capabilities. And you need to find ways in which you can evidence that you're meeting that capability. However, there are still a lot of myths about research and a lot of reasons why, as clinical occupational therapists, we don't have research embedded as part of our clinical practice. Some of those may be organizational level barriers, but also some of those are beliefs or perspectives that we hold. And I'd like to perhaps debunk some of these. Here are 3 common misperceptions that I come across when I talk to people about why they may or may not want to embark on doing research. So let's begin by the idea that research is perhaps done by others. Yes, of course, research into occupational therapy and occupational therapy practice has in the past been done by people from other professions and other disciplines. But I would argue that you as an occupational therapy practitioner are actually the best placed person to develop really clinically important ideas that need to be researched and to develop the evidence base for your own practice. And also in the same way that these days we try not to talk about doing research on patients or people with a particular condition, but rather researching with people, I would say the same should apply to us as professionals. So it shouldn't be other professions researching OT, but it should be us researching with other people from other disciplines, our own profession. And the other thing is that you may think, well, I'm not best placed really to develop a clinical research question, turn it into design a study around it and turn it into a successful grant application. But research involvement can actually occur at many different levels. And I will come back to this in one of the later slides. Another aspect is that research is enjoyable, or certainly can be very enjoyable. Despite what your experiences may have been as an undergraduate or postgraduate on taught programs, doing research is so much more than learning about statistics or how to undertake qualitative data analysis. And while some of us may have a very natural aptitude to deal with numbers or phenomenology, others find it challenging and continue to find it challenging throughout their research career. But as I said, there is so much more to it, and there are many aspects that are very enjoyable. The other thing is that unlike perhaps an undergraduate dissertation, research is not marked and you don't have to pass. And the other thing is that actually, if you do get involved in some research, and it's often said that once bitten by the research bug, then people never turn back. And I would certainly say that's been the case for me. And finally, really good research these days is done in large teams. And those teams are made up of many people with different skills and knowledge. And you don't have to be an expert in everything. The other thing is that you don't need to have a PhD or a master's in research. And of course, formal and higher level research training beyond your pre-registration education certainly helps, and maybe is a requirement if you want to become a leader in research. But in order to get involved in research and just learn about what good research practice might look like, there are many short courses, many of those free, available. One example is good clinical practice training, which is mandatory if you get involved in any aspect of research delivery. And it's offered both online, sometimes face-to-face, sometimes a combination of those. And these are available through the e-learning resources on the NHS websites. And there are many other free online tools and resources, which I'll highlight in a moment as well. The other thing is, as well as learning formally, gaining more knowledge and understanding, experience and skills are also important, and as important as formal qualifications. So if there are opportunities to become involved, for example, in an internship or a research placement, or just have the opportunity to shadow somebody who perhaps already has a dual role of working as a clinician and as a researcher, all of those are really helpful to give you some insight into what that might look like. And finally, what's really important is you really don't need to give up your career as a clinician and live on a poor student stipend in order to embark on further training or indeed embark on a clinical academic career. Because unlike 30 years ago for me, it was very much a split in the road where I had to make a choice. These days, the pathways are there and the funding is there to allow people to embark on a career that really encompasses and combines clinical work with research. So as I alluded earlier, research involvement can happen at many levels. And perhaps at the most basic level, and this applies to all of us, we have to use evidence for our own practice. It's part of our professional standards. We need to know how to search, critically appraise, and use evidence for our clinical practice. But perhaps we can also think about how we may facilitate our patients to actually become participants in studies. As I said, as I alluded to before, patients value the opportunity to become involved in research, or at least value to know about what opportunities exist, because at the end of the day, of course, it's a process of making their own choices and they have to participate voluntarily. But you can perhaps help identify patients' studies in which they have an opportunity to get involved in. For some of us, you may also think about starting to get involved in the delivery of research, and that is research that is perhaps conceived and designed and managed by others who have those skills and the track record and the funding in place, but where you can play a role in helping the delivery of that research. So as a clinical therapist, that could be helping to identify potential participants according to eligibility criteria. It could be that you are involved in undertaking assessments for data collection, or indeed delivering some of the interventions that are offered as part of the study or the trial that is running in the trust. And then for some of us, we go on to actually become the leaders of research, where we lead our own programs of research, and that's certainly something that I've eventually been able to do. So how do you get started at this very basic level of just knowing what research is available? And perhaps also knowing what's available for your patients and hence being able to signpost. So Be Part of Research is a website offered by the National Institute for Health Research, and it's a searchable platform where you can search very simply by research about a condition, or indeed according to a location. I've just put in a very simple search term here of finger fracture, something that as a hand therapist I treated lots, and I see lots of patients with finger fractures. we still have lots of unanswered questions, lots of treatment uncertainties about how best to manage them. So let's see if there are any studies available that my patients could participate in. And indeed, by searching that, I come across a trial, acronymed POINT. That acronym stands for a long title, which is a trial of surgery versus splinting for the treatment of proximal phalanx shaft finger fractures in adults. It's an active study currently open for recruitment. And on the website where I've taken this screenshot from, you would be able to click through the study details and find out more about where these studies are being conducted, who the lead investigators are, and so on. The other thing you can do is to try and find out what research is currently underway in your trust and in your clinical specialty. So each trust will have its own research and development department. And if you're unsure who to contact, you can find the R&D contract directory. Also, you can look for research in your particular clinical specialties. The National Institute for Health Research has a specialties website, which I'll show you in just a moment. And within that, you can find lots of signposts and information about different types of networks, groups, collaborations, that again, you can then find out what work is going on, what research, and make contact with people, reach out to people to try and get involved. And also you can search the NIHR portfolio for all the current and completed studies in your field. Obviously completed studies, so you can use the evidence in your practice, but also for current studies that are active and still recruiting, that perhaps you could play a part in helping to deliver. So I also want to talk to you about the clinical research networks. So the UKCRN, as it's called, has networks both in England, Northern Ireland, Scotland, and Wales. And in England, there are 15 local clinical research networks across England. And then there are 30 specialty areas. And these specialty areas include topics like children and young people, dementias and neurodegeneration, musculoskeletal conditions, stroke, primary care, social care, mental health, and of course others. But I've just listed some of the sort of main areas where perhaps as OTs you may work in and that you could identify with. And from there, you can click into the NIHR specialties. And I've just used the example here of mental health, just as a different example. So this is the mental health website. And then within that, you can find lots of other clickable links. So research units, research schools, and the portfolio of mental health research. So throughout this webinar, I have got lots of websites with clickable links. I'm not clicking through these now, navigating through them, but I very much encourage you to then go back to these and explore them under your own steam, and obviously in the areas that are relevant to your own particular practice. In order to search for current NIHR portfolio studies, so these are studies which are currently active and funded by the National Institute of Health Research. Again, you can search by an award type. I would, under award type here, I would choose research. And I've just put a very broad search term of occupational therapy because I was actually quite curious how much research there is going on within this area. And there were several active awards, but I've just chosen again just one example. So Return to Work After Stroke, or RETAKE for short, is a study currently active, led by the University of Nottingham by Professor Catherine Redford. So let's come back to gaining further knowledge and understanding around research methods. I touched on the fact that there are many courses and you can gain further qualifications. And here is just one example of an online course that is available through Future Learn, Improving Healthcare Through Clinical Research. Many of these courses are free or charge a very nominal fee for participating. And many of them also provide you with some continuing development credit points. I also talked about the fact that we all have to use evidence to underpin our practice. So for those of you who just want to brush up on evidence appraisal and evidence application, there's a superb set of resources available on the Cochrane Mental Health website. And it happens to be the Mental Health Research Partnership that's put these out. But actually they are very transferable and applicable to many of the other fields of practice. And there are a series of short YouTube videos, teaching resources, taking you through various types of critical appraisal, from introduction to critical appraisal to randomized controlled trials, systematic reviews, cohort studies, cross-sectional studies, and so on. And again, I'd encourage you to look at those or at least bookmark them so that as and when you want to come back and perhaps spend some time brushing up on these skills, you can use those. So then I finally want to talk to you about the many funded opportunities that now exist. So I already talked about the National Institute for Health and Care Research. So it's the research arm of the National Institute of the NHS. It was created in 2006. And as they said, it is a health research system in which the NHS supports outstanding individuals working in world-class facilities, conducting leading-edge research focused on the needs of patients and the public. So that's the mission of the NIHR. And as part of its mission, it has a very large portfolio of funding for research grants. It also supports a lot of infrastructure, but it also offers a lot of career development and personal fellowship schemes. And it's these that I want to talk to you a little bit more. I also want to flag up that there are many other funders now that also support clinical academics along similar ways that the NIHR does. But actually, this will be covered in one of the later webinars that Professor Pip Logan is going to do. The NIHR recognises that, particularly in the allied health professions, nurses and midwives, that the research participation and the opportunities to combine clinical research, a clinical career with research has been very limited. And so as a result, they launched the Integrated and Practitioner Academic Programme, or ICA programme for short. It's managed by the NIHR and funded by Health Education England. And again, I would encourage you to obviously look at their website. Here's just a screenshot, but the URL is embedded here as well. What they do is they offer a series of training awards at different levels, starting with an early career fellowship that would be pre-doctoral. So on the left here, most of us would have either a pre-registration degree or, for some of us, a diploma. And if you want to undertake perhaps master's level training, particular research master's level training, they offer a pre-doctoral clinical and practitioner academic fellowship, which is funded in that it pays your NHS clinical salary, where you continue to maintain your NHS rights and pension rights, but it protects your time to undertake research, further research experience and research training. And then post-masters and for those who wish to perhaps embark on doctoral level training, particularly doing a PhD, they offer a doctoral fellowship, and then postdoctorally an advanced clinical and practitioner academic fellowship. some of you may already be a little bit familiar with the NIHR HEE funded ICA fellowship scheme. You may remember that it had a very slightly different named fellowships. This is the recent renaming. The postdoctoral scheme had 2 different fellowships. That's now been combined into just one advanced fellowship. The other thing to highlight is they used to just have 1 annual round for these. They now have 2 rounds. So there are 2 opportunities per annum to apply for these. Now, these are national schemes and they are highly competitive. And it is often very difficult to find the time and the support within your clinical role in order to actually prepare a competitive application. And because of that, Health Education England also offers some regionally administered shorter internship and bridging awards. And you will find these across the different regions in England, and they are much shorter. They offer something like 1 day a week study release over about 6 to 12 months, depending which type of award. And there is some funding that comes to your trust to cover for backfill for that time. And a lot of these include some formal training. Sometimes that's an online master's level 20 credit module, depending on which award, or a series of mandatory masterclasses or other types of meetings where you come together as a cohort, and you are also importantly matched with a mentor who's there to support your bridging award and help you develop the networks and the support so that you can then apply for one of these NIHR ICA fellowships and hopefully more likely also to succeed with those. I've just put in here the links to the different ICA internship and bridging awards for England, for the different regions. So we have them divided by Northwest, Northeast and Yorkshire, West Midlands and East Midlands, each have their own. We have one for the East of England, which I manage, and I'm always happy to take particular questions about that. There is one for London, and then there is one that covers the Southwest. For those of you who are within the other countries, so Scotland, the Chief Scientist Office has a number of NRS career researcher fellowships, and the link is here that you can find out a little bit more. And also Wales offers 2 types of award. One is an NHS Research Time Award. The other one is a First into Research Fellowship. And again, the links are embedded here for you to find out some more. So finally, I want to come back to the importance of networking. As well as obviously equipping yourself with lots of information about the many opportunities there are. And I very much encourage you to do that. And you can do that in your own time. You can do that at home, and you can do that just with a good working internet connection. But I can't underline enough how important it is to actually network with people who are like-minded, with people who share your interest and passion for research and combining a career of clinical practice with research. And there are a number of organizations that I think, again, may help facilitate that. One is the Council for Allied Health Professions Research. It's the AHP voice for research. It's abbreviated as CAPA. And CAPA has regional hubs that organize events where people come together to present their research, to listen to invited speakers, and they also have their own regional AHP research champions. And you can, again, through this link, find out who your research champion is within your own region. So do make contact with them. They're there very much to help signpost you towards opportunities and other people that you might want to connect. If you're active on Twitter, you might want to follow NIHR Community. It's a great way of keeping up to date with all the new events and opportunities every time they are posted. And of course, the Royal College of OTs has its own research and development resources, which are regularly updated. You can also read online the R&D bulletin that comes out fortnightly on the members' website. Very recently, the RCOT has launched a research cafe. I think that's a virtual way of coming together with other people. And finally, I would very much encourage you to try and make links with your local university. Of course, some of those may include OT or physio programs, or certainly allied health professional programs where you may find people who can support you. But even if your university does not have health programs locally that are offered, then reach out to universities elsewhere, because one of the things that the pandemic, I think, has taught us is that really distance is no longer a barrier, because we can connect through Zoom and other platforms so easily now. There are also regional networks that support research. As I mentioned before, the NIHR actually has a whole host of infrastructure. And one of these are the NIHR Applied Research Collaborations, or ARCs. And they support applied health and care research that is very much at the implementation level. And there are, across England, there are 15 local partnerships between NHS providers, universities, and other organisations. And again, you can find out who your local ARC is. And ARCs have, as well as a research applied health and care research and implementation mission, they also have a research capacity building function, and they offer ARC fellowships. These tend to be short fellowships, and again, you will see information about when these schemes are open and to whom, and the guidance on how to apply on their regional websites. So I hope that I have inspired you to start your path in research today by exploring the links to websites and resources that I've given you, by inviting you to network with others who are interested in research. And finally, I'd like you to obviously do a little bit of your own research before you join the live Q&A webinar that I will be doing later on this month, and where I'll be happy to answer perhaps specific questions that you might have. I'd also like to just flag to you that starting your path in research is about creating some space for research within your clinical practice. And to finish, I'd very much encourage you to watch this lovely little YouTube video that was put together by colleagues in the northeast of England, and I think really brings us back to the patient, who is perhaps at the centre of all this, and who really wants us to ensure that we combine research within our everyday practice. So thank you for listening, and please feel free to contact me and reach out to me. My details are here, and I look forward to meeting some of you at the future question and answer live webinar. Thank you.